Hi, I'm Dr. Vijayalakshmi, consultant dermatologist here in Continental Hospital. Vitiligo has a severe psychological and a social impact both in our patients and their family. This is in part because of the misconception associated with the disease. So in this video, we'll discuss about what is vitiligo, what are the causes of the vitiligo, and what are the treatments which are available presently. So vitiligo is an autoimmune disorder in which patient develops white patches over the body. This occurs mostly over the sun-exposed areas like our hands, feet, forearm and face, but nevertheless, it can even occur over the sun-protected areas. Globally, around 1% of the patients develop vitiligo in their lifetime. Most of the patients develop vitiligo before the age of 40 and it's a disease of young adults. It is believed that it has a genetic predisposition because patients with vitiligo, around 20 to 30% of them usually have a family member who has vitiligo. Vitiligo sometimes can be associated with other autoimmune disorders like thyroid disorders, type 1 diabetes mellitus or alopecia areata. During the first visit, it's very difficult to see and tell the patient if the vitiligo is going to be confined to a given area or is it going to spread to the whole body. So what are the types of vitiligo? The most common type of vitiligo is vitiligo vulgaris. In this type, patient develops white patches all over the body. The second type is called as segmental vitiligo. In this type of vitiligo, patients develops white patches over one side of the body and in a confined area. The third type is called as lip tip vitiligo. Here, they develop vitiligous patches over the lips and over the fingertips or toe tips. Sometimes the vitiligo can be localized to a given area. That is called as localized vitiligo, which doesn't spread elsewhere. So what are the symptoms of vitiligo? The patients usually come to us because of the development of a white patch over the body. Most commonly, it occurs over the sun-exposed area, but can also occur over sun-protected areas too. They're usually asymptomatic. They usually don't have any itching over them and there's no pain over the lesions. When the disease is very active, we can see the development of vitiligo patches over the site of trauma, like a scratch or so. So what causes vitiligo? Vitiligo is believed to be an autoimmune disorder. There are cells called melanocytes which produce pigments in our body. Our body immune system recognizes the cell as foreign and start attacking them and destroying them. Once the melanocytes are lost, the pigment is gone from our body and the skin appears white in color. The other theory is called as neurogenic theory. This is mainly to explain the segmental vitiligo. It is believed that some of the nerve endings release various neurotoxins which damage the melanocyte. And thirdly, it is believed that there is a genetic predisposition. There are few genes which can be transmitted in the family. This belief is mainly because around 20 to 30% of the patients will have a family member who has vitiligo in them. How do we diagnose vitiligo? Vitiligo is mainly a clinical diagnosis. An experienced dermatologist can easily diagnose a vitiligo by clinical examination. But not all white lesions are vitiligo. There are certain infections, dryness which can appear white in them. To differentiate this, sometimes we do certain tests like wood slamp or skin biopsy when in doubt. Now coming to the treatment. Few decades back, there were very few treatments which were available for vitiligo. But over time, we have various both medical line of treatments and surgical line of treatments which are very effective. When the disease is very active, we try to control the disease by giving immunosuppressive, either topical or systemic like steroids, methotrexate, azathioprine, and recently other JAK inhibitors also come into play. When the disease is stable, that is the disease is not progressed in 1 year, then we offer the treatment of surgeries in our patient. In surgeries, what we do is we take skin from in the areas like thighs or buttocks and we process it and place it over the vitiliginous area. There are different kinds of surgeries like mini punch, suction blister grafting, non-culture melanocyte grafting, which all of the surgeries are presently being done in a Continental hospital with good results. Coming to the myths of vitiligo. Is vitiligo contagious? No, vitiligo is not a contagious disease. Does it increase by eating certain food items like white colored food items or sour food items? No, there is no association with food items and it is actually believed that food items which have antioxidants in them like vitamin C or vitamin A rich food are believed to have beneficial effect on them. There is no food restriction in our vitiligo patients. So I would like to conclude by saying that vitiligo is not a contagious disease. There are various both medical as well as surgical treatments available. You need to seek dermatologists at the earliest and discuss your options in treatment.